Hi, this video is the hair transplant restoration surgery on a client with a class 4 or 5 hair loss pattern. He's thinning from the front toward the back. He's going to be a class 6 in the future. Although he has some hair on top, but it's very thin. It's a vellus hair. It's a half the diameter of the hair on the side. And it grows a lot slower. So it's on the way out. So instead of waiting until completely bald and get something done, this client opted to do surgery. So that way it's less detectability. So hair transplant, again, is an art form. Requires a lot of the artistic and aesthetic detail to ensure a very natural result. From the mid-eyebrow to the hairline for Asian and black around 6.5 to 7. For Caucasian it's around 7.5 to 8.5 centimeter. For this client it's around almost 8 centimeter. And then the more narrow the face, the more arched back the hairline, the more round the face, the more flat the hairline is. As you can see, turn this way for me. There you go. He has his temple has gone back as well, and the temple is important because when we lower the hairline, recreate the hairline, if we don't fix the temple, he's gonna have a really wide forehead. It still look abnormal. So it's important for us to recreate it. The way he loses his temporal triangle here is not only halfway here, but it went further back here. So we're going to try to reinforce this area as well. As you know, for Caucasian it's most acute pointed backward, Asian is less, and then black is perpendicular. For women it's pointed forward. So we try not to change what his angle, his temple is, so we just follow the natural angle and try and fill in as much as we can. Bringing in the temple is a very difficult aesthetic. If people don't know what they're doing, they angle the temple, and I've seen some of them perpendicular, it looks very awkward. It's really on the temple is flat against the skin and pointed down backward. We use mostly root deco single hair, mostly in the frontal area, maybe toward the back you can mix with root deco too, but mostly root deco single hair. Because the temple is really designed to frame the face and softness and naturalness. It's not anything rough, so you don't want any big roots. If you look naturally and pay attention to carefully, most of the temple hair is so thin that it's very hard for us to find any thin hair that thin. But we attempt to do as much as we could and select the most finest hair. And you do it right, it's very hard for people to predict. From the hairline to the half of the head is around 2,500 grafts. This corner, it will eat up at least 200 to 300 grafts per temple. So hopefully it will get more than 2,500. So we can fill in the temple, but with this client, the temple is really extremely important. And again, if we don't, he has a nice lower hairline, but the forehead is so wide, it looks abnormal. It's a multiple year project for us, for this client, because he is completely thin from the front all the way to the back. So a year later, we'll be working toward back. But at least this year, we make the front, sure the front is really nice and strong, and allow him to have some hair and wear his hair however he want it. Then a year later, we work on the back and reinforce the front. With FUE, sometimes more than one surgery, 2, could be 3, just depending on how many hair we do. And we will have at least 2,500 grafts today. FUE, as you know, is the most advanced technology available and the least invasive of the two. Less painful than the strip method, FUT. It has a tiny dots of scar scattered throughout the back like a mosaic pattern, allowing you to wear your hair shorter. The strip method will leave you a linear scar, permanent for the rest of your life, and is more visible. But the strip has a point. It's cheaper, you can move more hair per day, so it works very well class 5, 6, or 7. But not everybody, even the advanced class, will opt for the strip method or the FUT. This client, realize that he's going to need multiple sessions, so he still opt for the FUE, the fact that he does not want that linear scar. Thank you.